Assalamu alaikum dear doctors. In this video I am discussing about TAS case number 48 and question number 2. So the question is, a 14-year-old girl presents having deliberately ingested an unidentified substance an uncertain time ago. Select the most likely substance from the above list that would result in the following biochemical abnormalities. The question is, arterial blood gas pH is about 7.30, partial pressure of carbon dioxide 4.8 kPa, partial pressure of oxygen 9.8 kPa, bicarbonate 17 milliequivalent per liter. Base excess is minus 8.1. Renal function is sodium about 137 millimole per liter, potassium 3.5 millimole per liter, chloride 108 milliequivalent per liter, urea 6.2 millimole per liter, creatinine 62 micromole per liter, and liver function test is ALT 2546 2546 unit per liter, ALP 347 unit per liter, bilirubin 4.4 micromole per liter, INR is about 3.2 and lactate 9 millimole per liter. So we read the explanation of this question. In the second scenario, the results demonstrate a metabolic acidosis as pH is 7.30 with an elevated anion gap is about 15.5 milliequivalent per liter. However, the plasma lactate concentration is also elevated at 9 millimole per liter, which would account for this. The remainder of the result exhibit a significant hepatic dysfunction. Remember, significant hepatic dysfunction, and therefore the most likely culprit from the list provided is paracetamol. Lactic acidosis is not unusual in significant paracetamol poisoning and can occur as an early phenomenon in the case of massive paracetamol ingestion or later as in the scenario as a result of hepatic dysfunction. So from this first para we understand that there is metabolic acidosis occur, and mainly they are diagnosing that is paracetamol poisoning because of lactic acidosis, and also there is significant hepatic dysfunction occur. Significant hepatic dysfunction we are seeing on the biochemical abnormalities. So paracetamol diagnosis is final. Now approximately 90% of the therapeutic paracetamol dose undergoes hepatic glucuronidation or sulfation. The remainder is metabolized by the cytochrome P450 oxidase system to produce the potentially toxic metabolite N-acetyl benzoquinoamine NAPQY. Under normal circumstances, this is bound by intracellular glutathione and detoxified to form cysteine and mercapturic acid conjugate. However, in the case of overdose, the glucuronidation and sulfation pathways become saturated and the intracellular glutathione is rapidly depleted, leading to a rise in the intracellular concentration of NAPQI, which causes widespread hepatocyte damage. N-acetylcysteine NAC, the treatment for paracetamol overdose, ameliorate NAPQI toxicity by a number of proposed mechanisms, including direct binding of NAPQI and reduction back to paracetamol, provision of inorganic sulfate for glutathione synthesis, and increasing glutathione availability. For maximum beneficial effect, it should be administered within 8 hours of an acute paracetamol overdose. So from this second paragraph we learned that paracetamol undergoes after ingestion glucuronidation or sulfation. This question come on the exam. Glucuronidation occur in children and sulfation occur in neonate. Remember these topics. And N-acetylcysteine is the treatment of choice of paracetamol overdose. N-acetylcysteine, and administered within 8 hours of an acute paracetamol overdose. Within 8 hours it is more effective. So please do subscribe and share my channel everyone. Thank you.